young people have been very uninformed, and that has led them to make poor sexual health decisions.
I'm a HIV champion. I've been living with HIV for 23 years because I was born with it. Kabla nijijue, I was taking it as a normal thing. Like sikuwa najua, mkajua tu like maybe mimi ni mgonjwa na meza dawa ndo nipone. But sasa naona after mimi kujua niliacha. Meaning that mimi ungeanza tu story ya HIV ningekuacha ujiongeleshe mimi niende. I hated myself due that time kwa tunaambiwa HIV ni ugonjwa mbaya, inaua, inakuja through sex.
After finishing Form 4, in our family things worsened. I was witnessing gender-based violence where my mother and my father used to fight, and this really affected me, especially after finishing Form 4 and being at home. This really affected me to an extent I almost committed suicide. That time, there were no trainings like mental health, nobody to talk to. But if they were there, if I had a person who I would talk to at that time, I think I wouldn't end up to that stage of committing suicide.
Since I knew my sexual orientation, my parents weren't that much comfortable, but I had to stand for myself because that is who I am, not whom they want me to be. So I started advocating for the LGBTQ rights because I felt that there are some gaps that in the society people are feeling they are left out.
So youth care basically advocates for self-care, and self-care is where young people are provided with the opportunity to be able to take care of themselves with or without the support of a healthcare provider in relation to issues of teenage pregnancy, reduction of HIV and AIDS in the community, sexual gender-based violence.
We've had issues of unsafe abortion. We have had unsafe sexual practices like not using condoms, not using family planning. We've had defaulters of ART treatments. Also, we've had issues of female genital mutilations and also early teenage pregnancies because most young people are unemployed and come from families that are not well up.
I think from inception, when we started implementing youth care, the facility manager did not own. She pushed the program to the community because the project design was seeking to work with the community health promoters and working with youth advocates and working with peer educators within our catchment population.
Through youth care, we do mostly sensitizations, and we also do follow-ups on young people who are on ART treatment. The follow-ups would be through physical dots and virtual dots. In Kamkunji, we've faced the triple threat issues because we were second in high prevalence of teenage pregnancy that was also in line with HIV prevalence. So youth care coming along and helping in sensitizing the community about safe sex practices, about good adherence to ART, and also doing condom distributions because we were doing community sensitization and outreaches where we gave out condoms during the sessions, has helped reduce the risks of infections, and also we've had good adherence in our CCC. I think the U is equals to U has been working well because of the youth care project.
Here in Majengo, we've been doing the prevention part of HIV and AIDS. We have been having focus group discussion where we discussed about the gender-based violence with the help of the facility personnel, HIV, parental role. That's what we have been doing so far.
My role was to advocate because in NAYA it's about advocacy. We were advocating for the LGBTI community rights to get equal rights and to be served equally amongst everyone.
What was lacking among the youth that youth care has really taken care of is information.
Youth care inisaidia kupata the information I have now, the capacity building, whereby hata mimi mwenyewe naweza chukua watoto niwaambie tukeni hapa leo tuongelele nini HIV, GBV. Hizo ni vitu zinatuhapenia sisi wenyewe. Kwa maana unapatanga sometimes tuna run away from reality when it is there to face it. So many kona because youth care imeni empower, imenipea those skills na the ability to talk. Nikamua I should not nyamaza because of it. Mimi nikamua let me use it to help my community.
It is important that youth are put to task and they also come together after being trained or capacity built so that they know what they want to advocate for. And that is what NAI has done in Homa Bay County, especially working along with the facilities, health facilities in Homa Bay County in various sub-counties. Yes, like Ndiwa and Rangwe and Homa Bay Town.
Currently, Homa Bay County is having a health burden, the triple threat that you're currently dealing with. So it was nice enough to start the youth care project because it will help the young people be at the forefront of creating the behavior of seeking health services on their own. And we thought it wise that this would help the young people or even to regulate the cases of triple threat that you are facing in Homa Bay County. The triple threats that you are currently having in Homa Bay County are the new HIV infections among the adolescents and young people. We have teenage pregnancies and gender-based violence. The teenage pregnancies are also contributed to the gender-based violence that have been experienced even from the close relatives, close friends that are defiling the young people and girls. The triple threat cannot be fought by one person. It has to involve me and everyone else. We've conducted so many community dialogues, we've had forums with the adolescents, we've reached out to the community gatekeepers whereby we have to get the parents, even the clergy, the chief, to engage them in the conversation that we are currently having.
I want to say that NAI is a partner that we've collaborated with in the county for very many years. Homa Bay County has a population of around 1.3 million people, and our incidence prevalence for HIV is around 15.2%. And out of this population, we have a population around 120,600 people living with HIV. And out of this, around 15,000 are adolescents and young people. There is a key partner. They support our review meetings, NAI support our mentors meeting, and all these are geared towards achieving quality of care for adolescents and young people, and to the larger extent, the general population. So we believe that the work that we work with them in the facilities through peer-to-peer mentorship, youth champions, activities that they do are very key to us as a program and also as a county government of Homa Bay and as a Department of Health, which we don't take for granted because there's a lot of impact.
The project of youth care was brought to the clinic in about 2 years ago, 2022. And at that time, we were struggling with certain indicators in health, basically the teenage pregnancies. We were also struggling with the low numbers of adolescents and youth turning up for testing, that is HIV testing. We were also struggling with the gender-based violence amongst the adolescents and the youths. So youth care came at the right time.
When we started, we had a challenge of reaching out to the males. So through continuous interventions, we are currently engaging males on their own. Like we can now have a quorum or a group of boys of up to 40 of them joining our sessions. They also appreciate, they come to terms that they have been missing a lot. They have always left behind during the past years.
We have been trained to make our clinics very receptive to the adolescents and very responsive to the needs of these adolescents and youths that we serve.
Also, we've identified champions among the members of County Assembly. Those are the MCAs. How we work with members of County Assembly is we try to create an enabling environment and also to show the members of County Assembly that there is need to invest in sexual reproductive health, there is a need to invest in self-care, because you cannot talk about a triple threat. You cannot talk about teenage pregnancy, you cannot talk about HIV and AIDS, you cannot talk about issues of child marriage when we do not have resources.
The issue of triple threats, the one for early pregnancies or what we call teenage pregnancies, and again sexual gender-based violence, is much of something that is alarming in our county. And when I realized that this is a group that is much of curbing the menace or curbing the disaster, I realized that this now I should be part and parcel.
One of the things that we are proud of is we are able to access timely data from the health facility and that information that we need. And we're just proud that we've built a strong movement of peer educators and youth advocates. These are young people who are now very strong and able to articulate issues of sexual reproductive health. They are able to engage, they are able also to reach out to other young people. So we are proud of the young people that we've been able to capacity build.
When Naya came and the youth care came, it really impacted many people, I included, that you can stand at your own, you can speak for yourself, you can speak even on behalf of everyone, that this is what I want, this is not what we want.
For me personally, youth care has really impacted my life positively. Through youth care activities, workshops, I've really gained a lot of knowledge. My skills have really grown. In networking, I've really grown because with youth care, I've been able to get myself into forums or spaces that I never imagined or I never thought I could see myself there. It is through youth care, I learned to fly with my broken wings, yes.
Engaging with other young people in the space, it really helped me because I used to listen to other people's stories. What they have gone through in that space for me, I think it was a moment, a very precious moment for me. That's where I got the courage to talk about my story. And for me, the project has really helped me to become more confident. Because in the years back, even here in my community, some people don't know about my story. But after the project, it really helped me. I can openly talk about what I've gone through as a young person. It really helped me to build my confidence. I've become more empowered. I can engage other young people. I can stand and speak and facilitate sessions. It really helped me in bringing up my confidence.
We appreciate the much that has been done within the 3 years. But then I would also wish, as a SECGEN for the entire CSOs and partners, that we scale it to other sub-counties. Yes, if time allows, and also resources. Yes, so that other youths in other regions like Kabondo may also be reached out to with such information to also enable them for sustainability for the entire county. Yes, so if we scale to other sub-counties, that will be a plus for Naya, Kenya.